let's get back to the drawing table and see what it says that is evidence-based practice. Which is really about this question: how do you know if one treatment will work better than another, or if it will do more harm than good? Don't think that everything we do that is from a good heart, from a compassionate heart, is good. Huh? Really, we want to know what is it that we want to do that we can learn from theory that will help someone to improve in the situation. So basically, what they call EBP is the integration of three major factors. So basically, the first point is really about empirical evidence. Very often, we start to write papers, right, then we start to prescribe, okay? But you usually should start with really go and see what the literature already tells us about this topic. And one quick tip for you, always go for the most quoted piece of research, right? Because it must be damn solid lah. That's why people keep on citing it. So go to see what the literature and research already says. Second point that's important, evidence-based practice, is really thinking about client characteristics. Even if you work with this particular community, remember all the clients, each individual family is quite different. So the age, the gender, culture, income level, understanding, mental health, all that are relevant. And that is why sometimes you cannot just transpose a program that you go and get so impressed, visiting, so impressed with, and then transpose it and try to do it in Singapore, because the contexts are very different. So you need to try to take into consideration some of these things in the gender and the culture. Then the most important thing, social workers' judgment. This is really about you having gone through the training, okay, and the discipline. You spend 3-4 years really reading about it, and then it makes you a professional, and then you have that judgment when you see a case. You mustn't give up on this. I say this as well because lately there have also been questions posed to quite many of us, and said that when we implement, for example, certain code of practice, certain protocols, will these protocols actually make us robots and just responding to a protocol? The answer is no, okay, because we are all human beings. The clients we work with are human beings. There is this dynamism going on that requires the social worker's judgment. So where these three actually overlaps, that is where evidence-based practice takes place. We can write policy, right? But then the implementation determines whether your policy intent really translates into reaching people. So a quick way for you to understand what this means is even something like this. It's really, you must have the right content, right curriculum, okay? Then the right people should be listening to it. If it's the right people that can really make use of the content, then the right timing, when they're most receptive to want to absorb and learn about that topic. So some of these things, right curriculum, right people, right timing, becomes important as a backdrop principle when you're talking about policy and implementation. Okay, there was a period in our history when generally people thought policy people were like, had higher IQ, they were more brilliant. But I think people are beginning to realize the ability to carry out and execute the operations translate into whether it has those outcomes. So I think both are equally important, and I will exhort you that if you are looking for jobs, try to have a combination of both, because I think it will really enrich your career. To me, policy implementation are really exciting area, and I enjoy doing that because I'm in both. And I've seen really how important it is that policy is connected. Operations actually reverts back to the policy intent. It is important to communicate clearly the spirit or intention behind the policy or project. Okay, very often you develop policy, then you give it to operations people, the operations people carry out. Afterwards, say, how come the outcome is like that? Are quite different, because we forgot to communicate really the original policy and intent of that program or that service or that policy.